Sure. Happy Monday night, everyone. Thanks so much for joining us. My name is Jasper Price. I'm the Director of Trans and Gender Expansive Programs at the LGBTQ Community Center of the Desert. Happy to see a bunch of faces that I know in this space tonight. And so, because of that, I'm not going to spend a whole lot of time talking about the center because I want to make sure that Brett and Lauren have as much time as they need for the session tonight. And so, the session is brought to you in collaboration with our partnership with Eisenhower Health. And so the only other thing that I will share is that this meeting is being recorded, just so folks know. And if you have questions throughout the session, Brett has put in the chat for you to please put your questions there. And at the end, we'll open it up for Q&A. So, Brett, it's all you.
I love that. Was sweet. Thank you. Yeah, hi. I know some of you. I think you've seen me. I've seen you at different events and different lectures. I run our partnerships and engagement, our lectures through the center with all of your team over the years. And tonight I'm very excited. Well, I'll do a little housekeeping as well. So to Jasper's point, it is being recorded. And so you'll hear a reverb because Lauren and I are in the same room right now. So if you hear double, that's why. So it is being recorded, and then we'll edit that. We will get it out on our website. It'll be out, then sent to the center. They will put it on there, send it out to anyone who registered as well. And then, yeah, we'll be able to get that out and moving forward. And so that'll be out probably within the next 7 to 10 days, if not sooner. And then, as you said, this is being recorded, as we said, so that's good. You feel free to, it does not capture video, but it'll capture voice and name. So if you prefer not to have that, you can ask any question or you can put it in the chat and I will relay that as well. We keep our confidentiality and everything as what to our audience members, and so no worries there. And if should anything pop up, then we edit that out unless I have other authorization to do so. With that in mind, yeah, so Lauren and I'm excited for what I know of Lauren. She's going to tell you a lot more because I always am kind of confused. I work with our PT, OT, and our voice activation people and voice therapists. I've gone through voice therapy myself over the years because I talk too much without microphones, and I lost my larynx for about a month and a half where I could not physically speak almost except a whisper. And it's through her team and her group that taught me really hands-on in the weeds type things of how to restructure, regroup, and bring my literally my career back to health and who I was as an individual, because I've always been a speaker in many ways. So with that, I'm very thankful for Lauren and her team, and I will pass it along to Lauren right now.
Hey, yay. Well, hi everyone. Thanks for coming on this Monday night. I'm so excited to speak with you all about my favorite topic, which is all things voice, huge voice nerd. And let me share my slides. We'll get that out of the way and we'll jump in. And thank you to everyone at the center and Brett for putting this together and making this happen. Such a fun opportunity. So yeah, we're going to be talking about the voice today, gender affirming voice, and all things that go along with it. I did just want to do a little intro, tell you all a little bit more about me. So my name's Lauren, she, her, and I'm a voice specialist and speech language pathologist at Eisenhower. I work at on the main campus in Rancho Mirage. I'm primarily in the outpatient clinic, which is in the Dolores Hope building. And I work with all adults. So I see anything and everything that someone might need speech therapy for, but I do see a lot of voice patients for all kinds of reasons, and that is just my favorite thing to do. And a little bit more about me. I'm originally from New York. I grew up like an hour north of New York City, the Hudson Valley area. And I did all my education in New York. So I have a bachelor's degree in speech therapy and classical voice performance. Former theater kid, a lot of singing, voice training stuff that I did in my youth. And then I got my master's degree in speech language pathology in New York before I moved to the desert. So I've been here for a few years now. I'm local in Palm Springs and love it here. And yeah, that's a little bit about me. So we'll jump on in. Before I get started on content, I did just want to give like a little shout out, special thanks to the experts, the pioneers in this field of like gender affirming voice, who are just amazing people and have really put in the work to train and educate like other clinicians on this topic. And they're the only reason that I'm qualified to speak on it. Gender affirming voice specifically is not like a topic that's covered on like a traditional speech language pathology course load, like in school. So the learning, the clinical experience really comes from other clinicians giving their time and their expertise. So just want to give them a little shout out before I jump in. But anyway, topics that I wanted to talk about today. So I wanted to use this time really as like a voice one-on-one, voice basics, like the foundations, kind of where to start. Because I think for a lot of people, at least what I've seen is that voice training can sometimes feel very daunting, a little bit overwhelming. There's a lot of information online, sometimes conflicting information, and sometimes it's just, where do we start? So I did want to bring it back to just the basics. So we're going to be talking about how the voice actually works, the anatomy of it, the different components. I want to talk about vocal hygiene. I think that's something that's overlooked a lot. And then breaking it down to the specific voice speech qualities that contribute to like traditional gender perception and making a voice sound more feminine or sound more masculine. So we're going to break it down to all those components. And then we are going to be having some fun going through a couple different voice, real simple exercises, like voice techniques, just like little things that I'm hoping might be helpful to work into your own practice, or your own voice journey, and feel encouraged to kind of practice along with me. That will be fun. And then I am going to talk about options. So if you're someone who's looking into voice training, where to go, online resources, how to find a provider, things like that. So we are going to talk about that. And I am going to save a good amount of space at the end for Q&A. So hold on to your questions. I'll love a question. But let's jump on into it. So voice basics, how the voice works. So I love this kind of three-component model when we're thinking about the voice, just to kind of break it down. So three components to the voice mechanism. That's going to be power, source, filter. The power is coming from the breath, from your lungs, from your diaphragm. We speak on the exhale. We sing on the exhale. The breath is the gas in the tank, the life force of the voice. So everything starts there. And the source are going to be the vocal cords themselves, which are, they sit right on top of the windpipe, the trachea, kind of right where your Adam's apple would be. That is your larynx. The vocal cords are sitting right behind there. And then the filter, the fun part, that is where resonance kind of takes shape. That's going to be your vocal tract, your throat, your mouth, your nasal cavity, where your sound is resonating and being shaped. So three basic components. I do have a fun little picture of these vocal cords, spooky little picture. But like I kind of said before, vocal cords, they're very small. They're small little things. They're like little elastic bands, and they sit right on top of the windpipe. Their main job in the body is to protect the airway. So it's actually just a lucky bonus that they can vibrate, and we can use them for speech and for voice and for singing and all those fun things. But their main job is to close real tightly over the airway when we're swallowing, if something starts to go down the wrong pipe. So that's their main job. They're controlled by muscles, so they open and close. And as we exhale, the vocal cords vibrate against each other and we get sound. There are a couple differences in like the anatomy of the vocal cords of the larynx. The vocal cords are a little bit thicker, a little bulkier in AMAB individuals, and a little lighter for AFAB. And okay, let's go to this picture. Did just put another little diagram like I was talking about before. Power source filter. The breath is really the foundation of the voice. We're going to be talking about the breath a little bit more later on. But let's jump into vocal hygiene, vocal health. I feel like this is a topic that is definitely overlooked. Not a lot of information on it unless you go searching. So vocal hygiene, how to take care of your voice is not, I think, really something on the mind unless maybe you're a singer, you're an actor, or someone who really is using their voice in a professional way in those spaces. But let's just break it down. So number one is hydration. The vocal cords vibrate against each other, so they need to be very lubricated. If they're dry, your voice is going to tire out a lot faster. It's going to feel irritated. That's when it might feel a little scratchy. So hydration is number one. And I always like to point out that there is a little bit of a time delay there. So if you drink a whole glass of water, that water is going down the esophagus into the stomach. It's not actually touching the vocal cords themselves, because if it did, it'd be going down the wrong pipe. So there's no magic tea or beverage that's gonna like soak the vocal cords. Warm beverages are very soothing. But there is a little bit of a time delay. So it's going to take a few hours for that water that you drank to reach your vocal cords. So I always think it's a better practice to try and be drinking consistently throughout the day, like a few sips each hour, rather than feeling like you have to chug a whole gallon of water like at a certain point. So that's my best tip for hydration. Throat clearing and coughing, that's a big one. Anytime you clear your throat or you cough, you're slamming the vocal cords together pretty harshly. So it's just a habit to be mindful of and kind of check in with yourself about, because I find a lot of people clear their throat like habitually or cough very often. So it's always good just to save your voice a little bit of irritation and kind of replace that with something else, whether that's taking a sip of water, doing a hard swallow, swallowing as hard as you can, and just avoiding that like harsh clear. So that's a great vocal hygiene tip. Vocally abusive behaviors, these are definitely things to be aware of. That would just be anything that's very rough on the voice. So screaming, shouting, yelling, talking over background noise, like in a club, loud restaurant, party, things like that, can definitely be rough on the voice, for sure. Another big one is reflux. Most of the voice patients that I see in the clinic, almost all of them struggle to some degree with reflux, whether that's GERD or that's LPR. The reflux can be very irritating on the throat, very drying. It can lead to more throat clearing. It can lead to more phlegm. And it can definitely cause hoarseness and a change in the voice. So that's definitely something to take a look at when we're trying to keep the voice as healthy as possible, keep it in the best shape to kind of start this voice training. But allergies, dryness, like sinus issues, we are not in a good place for allergies, dryness, sinus issues. So I definitely noticed a change in my voice when I moved here from New York just because of the dry air. Dries you out so fast. So that can definitely have an effect, something to think about. Any upper body tension too. I was talking to one of our PTs who told me that the two places in the body where you're going to start to feel tense, if you're feeling stressed, if you're feeling anxious, are your pelvic floor and your jaw. So if you're someone who holds a lot of tension in the jaw, that's where I hold mine, or you hold it in the neck or the shoulders, your voice box is right here. It's all connected. So I think of it like if you're holding a pen or a pencil and you're gripping the pen as tightly as you can, your hand is going to cramp up pretty fast. You're not going to get the nicest penmanship. It's the same thing with all these muscles. So any stretching, massage, that you can do throughout the day to manage that tension, if you think that's something you're struggling with, it's definitely going to have a positive effect. And then sleep. Sleep is a big one. Poor sleep, if you're running on low sleep, you might see some impact on the voice the next day, especially if it's like a persistent issue. There is really no like vocal hygiene trick or technique or exercise or strategy that's going to compensate for lack of sleep. I think when they've researched it, if you're running on low sleep, your body needs a lot more water to reach your like baseline level of hydration the next day. So I think that's part of the reason it can really impact the voice. So that's something to think about. And the fun stuff, dehydrating beverages, caffeine, alcohol. I did put that on here for two reasons. One, those are two of the biggest trigger foods for reflux. So if you're someone who really struggles with reflux, caffeine, alcohol can definitely set that off and exacerbate it, and then again have kind of a negative impact on the voice. And also they can be dehydrating. So if you're drinking caffeinated beverages, if you're drinking alcohol, you just want to drink some water to compensate for that. So I always like to point that out. Inhaled irritants can definitely be rough on the voice, vaping, smoking, that dry, dusty air I was talking about before. And then again, back to the breath, like we already kind of spoke on, is good posture, proper breath support, like not speaking on low air, like connecting with your breath and your diaphragm can make a huge difference in your voice and keeping it sustainable and comfortable and like having a little bit of a range to play with. So that's something to look at as well. And then vocal fatigue. Vocal fatigue, I think of that as the voice is really tiring out on you. So that is something I see a lot of patients for, is vocal fatigue or vocal strain. I'll see a lot of people where their voice is kind of giving out on them by the end of the workday, by the end of the week. They're losing their voice like periodically. So it has a lot to do with a lot of these different factors that we just talked about, but also each individual's vocal demands. So there are a lot of careers, teaching, that's a big one, where you're using your voice all day long and you're projecting your voice all day long. So everyone's vocal demands are going to be different. So I definitely think that's something to take stock of if you're starting like a voice training journey, is what's your vocal budget? Are you already feeling really fatigued with your voice by the end of the day without anything extra added on? Just something to think about. Anyway, so when to see an ENT. So if you are experiencing any significant issues with the voice, always a good idea to get it checked out and see what's going on with your vocal cords. That would be like a persistent hoarseness or like a sudden change in your vocal quality that's not going away, like over 2-3 weeks. Again, if you're losing your voice very often, if it's painful or uncomfortable when you're speaking or you're swallowing, any of those things, always good to kind of get a check and just make sure there's no vocal pathology that we would want to know about. And then if you were going to see an ENT, we coordinate a lot with the ENTs out here to kind of work with everyone and see what each individual person's voice needs and like what direction to take therapy and their voice plan. So I did want to mention that. So moving on, who can benefit from gender affirming voice training? And the answer is everybody and anybody is the answer. voice therapy, voice training really is for anyone who is looking to cultivate a voice that feels more aligned with their identity, that they feel more comfortable and confident with. It's definitely something to look into. I love the voice because it is just something that's so personal and so individual, and it's so tied to identity. It's how we're expressing ourselves to the world. We're expressing emotion and joy and everything. And it can make a huge impact if you're feeling comfortable with your voice or if you're not. Um, but I did want to mention this is for anyone across the gender spectrum, before, during, after hormone therapy, doesn't matter. There's no prior experience required. Your identity, your goals, what you're looking for is going to define the process. So it can really be very personalized and individualized, and it should be. So anyway, moving on, I did want to put a couple like mindsets um, just about this topic as well, because like I was mentioning before, I think it can be easy to feel a little overwhelmed with like voice training in general, especially if you're not someone who's coming from maybe a musical background or like a singing background. It can feel a little bit daunting, of like where to start, what to actually focus on, how do I make this realistic and sustainable, and how do I practice this? So I did want to put a couple just helpful mindsets. Is one, like thinking of voice training as really like exploring. We're exploring your voice and just like coming up with different voices and adding new sounds into your portfolio. I like to think of it that way. Is it's not a single setting. It's not getting rid of one voice and designing another one. It's giving you more options for qualities and sounds that you can play with and decide what feels right, what doesn't, and what environment you want to use each voice. So I really like to think of it as a voice portfolio. We're expanding it, exploring it, um, and really finding what feels comfortable and sustainable, what is gonna sound the best in your voice, feel the best, and be sustainable, be healthy. Um, and the progress is really, it's coming from curiosity. Like, I just love that word exploring. Like, we're playing with the voice and seeing what we can do with it and expanding it. I sometimes people will ask me, oh, can anyone like learn to sing or things like that? And I definitely think yes. There's, of course, like innate talent and innate things that come along with the voice, but the voice is controlled by muscles. I mean, you can train them and strengthen them and play around with them the same way you would with any other part of the body. So I really think of it like that way. Of we're just expanding this voice. So did want to touch on hormones a little bit and the effect it can have on the voice. Not an expert in this stuff by any means, but I did want to give a little overview of what you can expect. So testosterone works to deepen the voice, thickening, lengthening the vocal cords. And so you are gonna most likely have some impact of lowering the pitch over 6 to 12 months, probably, but those changes can kind of keep happening over the first year or two. Um, Resonance, communication style, like things like that, probably would still need some training, but the pitch for sure is probably gonna be modified and changed with tea. And it is definitely possible as someone's going through that transition to feel a little bit of instability with the voice as it's changing so much and getting used to your voice in this totally different range. So voice training is definitely still something that could be beneficial. Estrogen, on the other hand, on the reverse, is not doing much to actually change the physicality of the vocal cords themselves or the larynx. So there is usually not a significant change in pitch with taking estrogen alone. So that's where the voice training is going to come in. It can help a little bit with vocal flexibility or helping to reduce some like muscle tension that might be building up in the voice box, but I did want to give that little overview. And then beyond voice training, like behavioral voice training, voice therapy, and coaching, there are some surgical options for voice modification for sure. So I did put another quick overview on these options. Again, not the expert on these at all, so I don't know how much I could speak to the process or things like that. But I did want to kind of give an overview of what is out there and what the options are. And I wanted to mention that voice therapy, post-op voice therapy is most likely going to be recommended, even if you are pursuing a surgical option. Um, so for sign male at birth individuals, there's a couple of different options that I put on here. Again, I think everyone should have access to the slides after this, but feel free to take a picture if you want to. Um, but yeah, a couple different things. Wendler glottoplasty, I feel like that's the most common one that I hear about. Shortens, stiffens the vocal cords. Um, so you're getting a raise in your pitch. Couple other different options here. I do think for these surgeries, things like that, there'd probably be some travel involved if you're local here in the Coachella Valley. I don't think any of the ENTs are doing any of these procedures, but the bigger voice centers, Loma Linda, San Diego, things like that are probably going to have some options. And then anyway, here's the reverse, assigned female at birth, surgical options, thyroplasty, vocal fold augmentation. I do have a lot of voice patients who are getting Botox injections for a range of different reasons. I see a lot of individuals with age-related changes to the voice, where the vocal cords get a little thinner, they get a little weaker with age. And so Botox injections, they go in and they bulk up the vocal cords, plump them up so that they can vibrate more efficiently. That's getting pretty common, has some pretty good results. So yeah, there are definitely some options out there. So, we'll kind of jump into what I am typically working on when I'm getting patients and we're working on finding an authentic voice, all the different speech voice qualities that are going to have an impact. Pitch is the most obvious one, the most intuitive one, but there's so much else with the voice, with the speech that can be worked on and modified and changed. The pitch is not the end all be all. But of course, pitch is definitely going to have an effect, your average speaking pitch, and also your pitch flexibility and variation in your speech, your vocal range as you're speaking. That's definitely going to have an impact on gender perception. Resonance is another big one. And we are going to talk a little bit more about resonance today because I feel like it's not as intuitive and straightforward as pitch, but it can have a huge impact on how the voice is perceived. And I would say resonance is probably pitch resonance are probably the two biggest things that I'm working on with patients one-on-one. So resonance is really where the sound is resonating, where it's vibrating. So going back to earlier in the presentation when I talked about power source filter, the filter where we're shaping the sound has a huge impact on the quality that comes out. So if your voice is resonating very low in a very throaty, chestier, lower place, it's going to have a different perception, or we could have very bright, very forward, sharper resonance. The resonance is in the mouth, it's out. So that's a fun one to play with. There's a lot that can be done with the resonance. We're going to talk about that a little bit more. But intonation, that's going to be your inflections, your expressiveness in your speech, like your melody. Articulation is another fun one that's kind of fun to work on, is how precise and clear your articulation is, your consonant sounds are. That's going to have a big impact as well as your volume. louder voices usually are going to go along with like a heavier vocal weight and have traditionally more of a masculine perceived sound. As well as speech rate, the rhythm of your speech, how fast, how slow you're speaking. And then there's all so many nonverbal, pragmatic things that go along as well, facial expression and gestures and communication style and the actual words that you're using or the filler words that you're using are definitely going to have an impact. So we will keep it rolling on this topic. So for traditionally feminine perceived voices, there's going to be a higher speaking pitch. So I did put on the slide the average speaking range for traditionally feminine perceived voices. That's going to be 180 to 220 hertz. And then we're going for a very bright forward resonance, like I was mentioning, in the mouth, in the face. The voice is very forward. I like to say out on the balcony and not down in the basement. So we're going for our balcony voice. And then the airflow, usually we are leaning towards a softer, lighter, breezier airflow, not necessarily breathy or weak sounding, but there's just a softness there, that lighter vocal weight. It's not as harsh of a sound. And then intonation, we're looking for more of a pitch variation. So having a bigger range to work with. So at the end of your sentences, you can go up, you're excited, you're putting emphasis on something, and the pitch is changing along with that. And then for articulation, we're looking for clearer, crisper consonant sounds. More forward vowels, things like that, exaggerating the speech a little bit more. For traditionally masculine perceived voices, it's just pretty much going to be the opposite of all those things. So we're going for lower speaker pitch. It's going to be 100 to 130 hertz, a deeper resonance, chest dominant sort of sound. Airflow, it's going to be really precise, firm onset. It's not breathy, it's firm, it's concise, it's clear, a heavier vocal weight. Intonation is going to be more stable, probably a little more grounded pitch pattern in your speech. And then the articulation is going to be a little more relaxed. And I did put the gender neutral pitch range on there. That 145 to 175 hertz is typically what's considered that gender neutral range. So we will move it on. So we're going to talk about some breath work real quick. Breath is the life force, the foundation. So focusing on the breath, even if it's just a little bit here and there, is going to be so helpful, so impactful for your voice journey. There is so much more range and things you can do with the voice if you have that breath support, right? Because typically where I see people start to go wrong or start to run into issues with voice training of it feeling strained or tight or not feeling comfortable is we're trying to get all the power from here, from the throat, from the voice box. We're pushing from here, and this is just the source. So we're really looking for a relaxed throat, open throat posture, and we're getting all of that power from the breath. And I like to, this is one of my favorite voice factoids, is the voice and the nervous system are so intimately connected and go hand in hand. Because the vocal cord is controlled by the vagus nerve. The vagus nerve is also the nerve responsible for controlling that nervous system and regulating it. So, which is kind of why we can hear emotion in people's voices. Somebody sounds choked up, they sound upset. There's such a huge connection there. So, any breath work, any voice work that you might be starting to play around with is usually going to have a positive impact on nervous system regulation, especially if you're doing long exhales, some breathing exercises. It's just kind of calming that fight or flight response, or any gentle humming is we're really stimulating that vagus nerve and calming everything down. So I always like to point that out. I think that's very cool. But some breathing exercises, I thought I could just give a couple like simple foundational things. So if you, because I hear this a lot that people come in, I'm working with them, and they're kind of realizing, I don't think I'm really taking a deep breath, or I don't know how to use my diaphragm when I'm speaking, or I think I'm running out of air, and just like where to even begin with that. So, diaphragmatic breathing, belly breathing really just means that we're focusing on getting a deeper breath. Your diaphragm, you can't really see it, I guess, on the computer, but it's kind of right at the top of your abdomen, like bottom of the rib cage. And when you're breathing in, you're going to feel that diaphragm is extending, inflating, kind of like a balloon. And then on the exhale, it's going to deflate. And it's a subtle movement, very subtle, but bringing your attention to it and being mindful of it, it's really going to be impactful. So just sitting with the breath like a few times throughout the day. So kind of a great place to start is, what does it feel like when you're engaging your diaphragm and you're bringing your attention there? So putting your hand on the stomach above that diaphragm, inhaling gently through the nose, and then exhaling through the mouth, while you're keeping the throat very relaxed is the key. Because even when I'm doing this with myself, and I'll kind of get started and taking some deep breaths, I'll kind of realize, oh, I'm tightening up in the throat. Why am I doing that? All these muscles are kind of over engaged, and they don't need to be. And let me kind of keep that throat relaxed and open. And then box breathing, you might be familiar with box breathing already. I love a box breathe. But this is just a little bit more structured. So same thing we were doing with that diaphragm. You're just inhaling for 4, holding your breath for 4, and then exhaling for 6, and then repeating the cycle. So just a couple simple foundational things to get you started. I like kind of treating these as just techniques to kind of keep in the routine throughout the day, right? You're in between meetings, you have a moment, you're in the car, you take just a minute or two, and you're doing a little bit of breath work. And then to take it to the next step is pair that intentional breath support with some voice, with some speech. So what does it feel like when I'm voicing or I'm speaking and I took a really deep, intentional breath, right? How is that going to make my voice feel more comfortable, my throat feel more relaxed, and really support my sound? And that's as simple as starting really small. So you're having good posture, you're sitting there, you're standing, you're taking that intentional breath, and then pairing it maybe with a word. So you're breathing in, hey, right? And you're really feeling that diaphragm supporting you. Or just doing a counting, a 1, 2, 3. So you're taking that breath. 1, 2, 3. I'm trying to lift that voice with the breath. And then kind of moving on to sentences, phrases, and taking a conscious breath before each one is a great place to start. But yeah, with a voice practice, if you're trying to get in a routine with it, highly recommend putting some sort of check in with the breath or breath work or breathing exercise, maybe like 1, 2 minutes before you move on to the other fun voice stuff. And then that's a great thing to check in with yourself when you're speaking throughout the day. If you're feeling like some tightness or some strain, or the voice is kind of giving out on you, is resetting the breath, right? Taking a really conscious breath before you speak and you move on to your next thought, things like that. So that's my breath spiel. And now let's talk about some voice exercises, voice techniques. So I did want to start with feminizing the voice. Where are we going to start? Some little foundational exercises that you can start working on your own. The goals with these are going to be playing around with raising the pitch, if that is a goal. Aiming for brighter forward resonance, more oral resonance, and then that softer, lighter vocal quality, airflow. So for pitch work, favorite thing to start with when we're trying to play with the range is just a pitch glide. So we're gliding the voice from a lower place to a higher place. And this can be very customized to where you're at and what feels right in your voice. And I like to keep it very gentle. So we're not going for volume or pushing. We're going for gentle, making it feel comfortable. Because it can be very easy to strain the voice or have it feel tight or pressed, especially if we're going for pitches that are not in our comfort zone. So gentle pitch glides. We can do this on a hum. My favorite is to do it on a woo or a knoll, like a grassy knoll, so it feels nice and comfortable. So if I was going to demonstrate, if I wanted to do a pitch glide and really explore my whole range from the bottom of my range all the way up to the top, the ceiling, we could do that. I would use a comfortable volume. I'm going to do it for you all. So here we go. Feel free to do it with me too if you have your mic off. Would love that. But on a woo, we're starting on a lower pitch. And kind of playing around. So we can really explore the whole range, or we can do just slight glides. Sometimes that's an easier place to start. So starting from like a medium low place to slightly higher. Ooh, ooh. Now my voice is up here. Ooh. Now my voice is up here. And kind of just playing around with it, getting the voice comfortable with being flexible in that different pitch range. So pitch glides, love those. I think those are a great place to start as long as you're keeping it comfortable. For the resonance, the best way to practice the resonance is on a hum, on an M. M ends, they're nasal sounds, they resonate in the nose naturally, so they're naturally bringing your voice forward into that more forward frontal resonance space. So any humming on a comfortable pitch or on a pitch that we're working on is going to be a great place to start. So we're doing a nice gentle hum. And what I like to pay attention to at these is one, does it feel relaxed? Does it feel comfortable? And playing around with the pitch, but also where is the voice vibrating? So that's something I would pay attention to. Are you feeling it all in the throat, all in the voice box? Are you feeling any vibrations buzzing in the mask, the nose, the mouth, the lips, right? Because that's what we're going for, that balcony voice, that forward voice placement. So that's it. Another easy one. Easy one to work into your routine. Great place to start. Just getting that forward voice placement. And then for that softer, lighter quality, I'd love to practice this with some counting, right? So we're counting maybe 1 to 5 to start and just playing around with how soft and light and breezy can we keep the voice. 1, 2, 3, 4, 5, right? As on the reverse, if I wanted to go for a darker chest dominant quality, 1, 2, 3, 4, 5, right? And just seeing that that contrast there. Thinking of a smile in the voice really helps brighten things up and keep it forward. So it's a really great tip when you're practicing at home. Okay, moving on to the other side of the spectrum. If we're going for more masculine voice goals, couple different options for that. Again, it's going to be the pitch glides, just now we're going to be working in reverse. So a descending pitch glide, I still like the woo and the knoll or a hum. And this time we'd be starting from a higher place and then working our way down. So, no. You're trying to keep the voice really smooth throughout. This is a great place to work out any like breaks or kinks. And again, you can explore your whole voice range, really warm it up and keep it flexible, or we can just keep it a a little shorter. We're going from a medium high place to a little bit lower. Ooh, ooh. And now I'm talking down here. Um, so that's where I would start the pitch glides for that. This is another fun one if we're wanting to work on that lower pitch, that deeper chest dominant resonance is starting with a hum and M again. And then releasing and opening up on a nice full ah. So just to give you a demo of that one, starting maybe on a lower pitch would be like ah, right? And just practicing that chest dominant, deeper voice space. And again, we're playing around with the pitch on that one, whatever feels comfortable, and just exploring the voice. Ah, and now I'm talking down here. So that's a fun one. We're going for a nice full sound. And then kind of working on lowering the pitch, but adding a little bit of speech in. Love the counting again. So starting from 10 or maybe starting from 5 and then working the pitch backwards, like a progressively lower pitch on that. If you're musically inclined at all, using a keyboard or like a starting pitch and kind of working down on a scale can be really helpful. Like a 3, 2, 1, and here I am down here in this space. So that's a real easy, simple one to get started with. But okay, moving on from that, my bonus exercise. So if pitch work is feeling uncomfortable, or it's every time I try to raise my pitch or lower my pitch, it feels a little tight, feels strained, doesn't feel comfortable, or you're wanting to really work on the pitch and explore that more. My favorite vocal technique, voice exercise is going to be the straw one, straw phonation or cup bubbles. I call it, goes by many names. But it is a semi-occluded vocal tract exercise. So this is a gold standard voice therapy technique. I know a lot of singers use the straw cup bubbles exercise for warming up the voice, working on repertoire. I think of it as voice yoga, right? It's not really strengthening. It's not too intense on the voice. It's meant to be relaxing the throat, calming everything down and putting everything back into balance, your respiration and your phonation and your resonance. So this is a great option for managing vocal fatigue or vocal strain, and just knowing that you're supported to explore your pitch range and work on it in a healthy way. All you need for, if we were in person, I maybe would have brought some straws and some cups and we could have all had a little bubble party together. But I'll just do a little demo for everyone. All you need is a cup with a little bit of water in it and a straw. Any straw, boba straw, coffee stir, regular straw is going to work. We're putting the straw just under the surface of the water. If you go all the way to the bottom, the pressure is different. You'll have to push a little bit harder. So right under the surface or right in the middle is great. And this is a silly one, but we're literally just blowing bubbles. You're going for smooth, calm, consistent bubbles popping in the cup. So this is another great way to get familiar with your breath and your airflow. If the bubbles are jumping out of the cup and splashing you in the face, you're probably pushing too hard, right? Maybe more than you need to. So that's great feedback for you. And then we're going to turn the voice on. That's the fun part. So really, we're kind of doing an ooh, because that's the shape that the lips are going to be in if you're around the straw. So starting on any comfortable pitch. And we're blowing bubbles. It should feel easy, breezy. It should feel comfortable. It should not hurt or feel strained. So when I'm working with this bubble exercise, I like to practice a few comfortable pitches, and I also like to do those pitch glides again. So Maybe I'm doing single pitches a few times first in that kind of pitch range that I'm looking to cultivate. Seeing how smooth and steady I could keep it. And then maybe I move on to some pitch glides. So I'm going from low in my range to higher in my range. And then I'm coming back down. You can also sing through the straw. That's really fun. A happy birthday, a twinkle twinkle. You can play around with it. Usually when I'm seeing patients one-on-one, I'll take out my keyboard and we will work on specific pitches and kind of really honing in on what is your optimum speaking pitch, what is that target range that we're wanting to work on. And I'm usually starting with the bubbles, because if we can get a really comfortable sound, smooth sound on those pitches with the straw, that's where we start. We're building a great foundation, and then we're taking the straw away and we're moving to more open mouth voicing and other exercises. But anyway, I love the bubbles, so I think it's great as a vocal warm up, a vocal reset, just to do a couple minutes throughout the day and just to play around, explore the pitch a little bit more. So I love that one. I would definitely play with the cup bubbles. What is next? So I'm not really sure where everyone's at on our meeting, but I kind of just wanted to talk about, really, for everyone who may be starting their voice journey or like thinking about where to start, and like how do we go about building a sustainable practice routine? Because it's one thing to kind of achieve a higher pitch or a better resonance on these bubbles, or like a simple little voice exercise or reading sentences out loud. It's another thing to really make that comfortable in your everyday life, in your conversations, and kind of getting a new home base. Speech is supposed to be automatic. We're not supposed to have to think about it so hard. It's just something that comes out. So it really takes time to build new speaking habits and speaking patterns. And because we're training like a new normal, right? New normal, new habitual, new home base. So 5 to 10 minutes, I think, is more than enough for like a good place to start, right? You want to keep it sustainable, realistic, consistent practice. Those small changes, like over time, are going to be much more impactful. And also, you want to pay attention to what your vocal demands are in your life already, right? If you're not doing a lot of voicing during the day, maybe you live alone or your job doesn't require a lot of speaking, you might have so much more time and vocal budget to kind of play around and do all these things. And you might need to be very strategic about it if you already have very, very high vocal demands, or you're already dealing with some vocal fatigue and trying to manage that in your life. So 5 to 10 minutes is a great place to start. And I think focusing on one thing at a time. You could drive yourself crazy thinking about the pitch and the resonance and the breath and everything, and where's my voice placement. So picking one thing at a time, right? I'm focusing on pitch glides today and making them feel really comfortable, or I'm focusing on my breath support, and that's my goal for this week. Is I'm going to be really intentional with my breath when I'm speaking, so I'm not running out of air. So one focus at a time. I know this does not feel comfortable for a lot of people. Nobody likes to listen to their self talk. But if it feels productive, if it feels comfortable, it's not triggering, recording your voice can definitely be helpful, just to kind of monitor progress over time and kind of hear back and see how different things sound. And sometimes it's just simple as getting started with like a vocal warm-up routine, right? I mean, you're not going to go run a marathon or sing on Broadway without warming up your voice. I would hope not. So we're warming up your speaking voice, right? Maybe that's the practice, right? Before you go to work, before you jump on a phone call or you hang out with friends, like let's warm up that voice and find that new home base before we go have a good time and we're speaking. And then taking breaks, right? Because life is so unpredictable, right? You get sick, you have too much on your plate, you're traveling, the voice is going to maybe take a step back, but just kind of coming back to it, resting when you need to and just making little changes as you go. I also think it's helpful if you're starting to think about this. How am I going to find my authentic voice? What does that even sound like? What does that even look like? Is to try and get a little specific about it, right? Reflect on it, journal on it. You know, when I think about my ideal voice or what I want my voice to sound like, what are the words or the images or the specific qualities that come up, and like kind of pinpointing those, because then that's something we can really start to hone in on if we're doing some voice training. And then I think it can definitely be helpful to think about voices you've encountered that you admire, or and kind of getting specific on what you admire about them, right? Not that we're going to pick a celebrity voice or a cartoon voice or an anime voice and like this is the voice that we're going to be imitating all the time, but kind of getting specific on what do we like about that voice? What do we like about Chapel Roan's voice or Meg from Hercules' voice, right? And is it their resonance? Is it their pitch? And just kind of pinpointing that. So I think that can definitely be helpful in a where to start, what are the goals sort of place. And I did want to talk about online resources. So there is so much that you can accomplish doing some voice training on your own. But there are so many online resources. I think it can maybe even be a little too saturated and like finding high quality content or stuff that's not conflicting. So I did want to give a little shout out to my favorite like creator, Seattle Voice Lab, Jordan Ross. I think Jordan is a speech therapist. I'm not sure about the other two. And Trans Voice Lessons. I think all three of them are on YouTube, probably on TikTok. They have their own websites and probably have their own practice regimens and trainings and things like that. So I think they're very high quality. I would check those out if you haven't come across them already. And then apps. There's so many pitch apps that you can play around with that you can get on your phone. I think all the apps that I listed on here, except for the piano one, are available on Android and iPhone. And I would just be aware, there might be slight differences in like the accuracy, but if we're just going for something that's going to give you some visual feedback, for the pitch, they're great options. Acoustic Gender Space, that's a browser-based app that will kind of show you where you're at on a chart with your resonance, with your pitch. So there's some good options out there. Those are the ones that I would recommend. I put Piano for iPhone on there because if you're playing around with the voice and the pitch, there's some great like online little keyboard apps that have all the notes labeled, so you can kind of get specific on what pitches you're practicing and which ones feel comfortable. So those are my resources. And then if you're considering working with a provider, there's a couple different ways to go about that. Just a vocal coach, right? There's a lot of options for telehealth, for Zoom, for asynchronous trainings online, or finding voice specialized SLP. Not every speech pathologist is going to be trained in voice or in gender affirming voice. So it's definitely worth it to find the right provider. And I think it can be very helpful when I'm getting these patients. A lot of them are coming to me and saying like, doing it on their own became too overwhelming and they didn't know where to start and they weren't consistent with it and they needed someone to really guide them and keep them accountable and like have a space to kind of workshop things. So definitely a great idea. We do offer this voice training at Eisenhower, our vocal congruence program, and just want to give a little info on it. Usually 8 to 12 like one-on-one sessions is how long I'm seeing someone for. They'd be 30, 45-minute sessions, one-on-one with the speech pathologist, me. And insurance is accepted. And that's going to be at the Eisenhower main campus, the Dolores Hope Building. So we definitely have that program here, but I know there are a lot of barriers depending on where you live, finances, insurance. So I did want to put this website on here if you haven't seen it before. It's the Vocal Congruence Project. It's a provider map. So you can search in your area and really find the right provider for you, whether that's searching by telehealth or a singing coach or a vocal coach or or a speech pathologist. So that I would definitely recommend checking out as well. And that concludes it. I think I know maybe I went a little over time, but I think we have a little bit of time for questions. I wasn't looking at the chat.
Yeah, nothing in the chat as yet, but I think with a small group, if you have questions,
Yeah, I
feel
would
free if
love
you
a
feel
question.
comfortable to unmute and ask a question and or
Yeah.
put it in the chat. But
I also was going to mention that I will be at the Palm Springs Trans Remembrance Day this Thursday. So if you happen to be there, I will be there. You can definitely come chat with me in person. Or if you think of a question, I will be there. Would love to chat.
all right, well, I'll open it up to the group if anybody has any thoughts, or Jasper or Bex or most of anyone. Paulina, maybe. Putting you on the spot, Paulina. You know me.
Yeah, I hope it was helpful. I wanted to
Yeah.
gear this towards, you know, the basics and where to start if you're getting started. But if you're someone who's already done some voice training or um, is already kind of on that journey, I hope you still got something out of it. But yeah.
Yeah, I just want to say thanks so much, Lauren and Brett, for taking the time today. This is my first little venture forth into exploring my own voice, like my own authentic voice. And I noticed that my voice like kind of goes all over the place depending on the audience that I'm talking to.
Yeah.
I know that when I'm with friends, it can go higher and lower. If I'm like in a serious mood or if I'm like on the phone, it goes or right now it like goes into like a deeper, lower kind of pitch.
Yeah.
And I guess kind of my question for you, and I'll be at the Trans Day of Remembrance event too, so maybe I'll just talk to you there.
Yeah.
But I definitely want to do this program, the Vocal Congruence program at Eisenhower. Um, but my question, I guess, is how does that change like that like baseline voice, or do I have to just
Yeah.
constantly think about it? Because
Mhm.
is that something that I'll have to just think about for the rest of my life?
That's a great question. I like that question. Um, I think to answer your question, I hear that a lot when I'm working with people is, oh, I can get like this better, this voice, this authentic voice in our session or when I'm really thinking about it, but then I'm at work, I'm talking about something, I'm having a more complex discussion, and then it kind of like falls back to where it is. Because that's a multitasking thing, right? Is because exactly like you said, it's not the default, the baseline. So it is taking like some conscious mental effort. And you might be at a place where it's not physically effortful to get that voice out, but it's the mental effort piece of it. And that definitely takes a lot of time, and like consistency. So I think of it as like you're being very intentional with your voice, right? And just kind of being mindful. So just the first part of that is being aware, like, oh, when the voice drops back down to a lower place or it's jumping up to a higher place, recognizing it, and then how are we going to reset the voice back to where you'd like it to be? And that's definitely something that takes time and definitely something that I'm working on in like my later sessions, like some more like conversation-based therapy, where, okay, we're going to read a passage, or I'm going to give you a topic and tell me a story or talk to me about this, and then trying to keep the voice in that optimum place. So it takes a lot of practice, I guess, to answer your question.
So Lauren, if this is the, say, a 101 kind of
Mhm.
course, through your expertise and through the department, what is the next phase? Say you complete this session or this series. Is there a follow-up session? Is there a 301, a 401, kind of a master's kind of scenario? I mean, how do you progress once you've started
That's
path?
a good question. And I think that's something that we're still figuring out as we get more people coming to the clinic. I don't have like a group session at the moment, but that's something that I've been looking into starting, like a practice group whether that meets like monthly or weekly or how that would work. But after those like 8 to 12 visits, usually, and not that the 12 is the hard cutoff. There's kind of like the average for how long I'm working with someone. Um, but say we start at like a once a week with our visits, and then as we get further along, maybe we kind of push it back out, and now I'm seeing someone once a month, or I'm seeing someone every few weeks. So you're having the time to work on things on your own and maintain and make more progress, and then kind of come back in for a checkup. But I guess like the final piece of it is then the real world practice, right? There's only so much that we can emulate in like a therapy space. But once you have the tools in your toolbox and are getting comfortable with that new voice, the best practice is going to be practicing in your own environment. But I do think group sessions, I think there are some people who do them online. So I think that's something I can look into, but I think groups can be helpful too. Yeah.
I've got one for you, Lauren.
Yeah.
I'm curious how often you see when someone might be in the beginning of their journey, which I am, or even not in the beginning, how often you experience someone going through like an imposter syndrome kind of deal of like, yes, we are discovering and exploring for your authentic voice, but like what a knowing that we are actively changing it to what the natural or the default is,
Yeah.
do you have any tips of like getting past that?
Yeah, I think that definitely comes up a lot. Is depending on the person, like when we're like trying on different qualities or like different pitch ranges with whatever we might be doing, like in the session on like an exercise or like speech or whatever. Um, it's like I have a lot of people tell me, "Ooh, that felt really weird," or like this feels really silly, or I don't see myself speaking that way, like in real life. Um, and I think that's kind of where it starts, right? Is like we have to exaggerate and make all these things more pronounced, like as you start. And so you can just achieve it, right? We're achieving that different pitch or that resonance or that like quality in that exaggerated way. Now that you're more comfortable with it, now we kind of bring it back, right? To what's going to really sound more natural. But I think the imposter syndrome thing, is interesting that you bring it up because I do think that's probably part of the process and like to be expected. Um, and I do find with a lot of people that I've seen, like they're using kind of that authentic voice or like their voice, that optimum voice in like certain environments. Like, okay, I've gotten comfortable using that voice with the people I'm close with, and now the next step is kind of using that voice at work. Or I'm doing it at work, I'm doing it with friends, but like family, or I'm doing it with strangers and now doing it with like people I know, is another part of the process. I hope that answers your question. Okay.
It did. Cool. Thank you.
Okay, cool. Sweet.
All right. Any other questions before we close out and let you get off to dinner or
Yeah,
Yeah.
no
or get out of
questions.
work?
Just
It looks like you're still at work, right?
Yeah,
yeah,
I'll be,
yeah, no questions. I just wanted to say thank you so much. I feel like these are things that folks ask about often, and so knowing that there are things that folks can do, potentially when even sessions aren't accessible is huge.
yeah.
So definitely
Yeah, I definitely
appreciate you.
wanted to cover that.
Yeah, I definitely appreciate you sharing those resources as well, and love hearing more from you about what is available so close to home. So thanks
Yeah.
so much.
Oh, thank you. Thank you. It was so nice to have the opportunity to come and talk about one of my favorite things. And yeah, I'll be there on Thursday in Palm Springs. If you happen to be there, come say hi. And thanks everyone for your time. Happy Monday.
Yeah, and there was a note. I mean, Paulina, thank you for putting in. I think you said if you have an iPhone, the Garage Band.
Mhm.
It's a piano in the app as well
Oh,
for
I didn't know
record
that in
vocals.
GarageBand.
Yeah,
Okay, that's good to know.
yeah.
Some
So
of
that's
like the mobile like keyboard piano apps are annoying because it's like teaching you to play piano and there's like a million different buttons and features and like pop-ups. So if you have an iPhone, Piano for iPhone it's literally just the keyboard and with the notes labeled, and it's not trying to do anything else, anything annoying. So that's why I put that one on there. But yeah, GarageBand, that's good to know.
All right. Well, with that, unless there's a final, we'll just bid everyone a great evening. And Jasper, thank you. And Bex, thank you. And nice to see the familiar faces and some new faces.
Yeah.
All
Thanks,
right.
everyone.
All right. Have a great evening. And this will be, as I said, this will be sent and then online and sent out to everybody very soon.
Great. Thank you so much. Good night,
Thank
everyone.
Thank you.
Good night, everyone.